Hi, my name is Alaa Youssef. I'm a student at the University of Kansas competing in the undergraduate division. My topic is the role of rhamnolipids on Pseudomonas aeruginosa biofilm development. I'm going to start off discussing some of the characteristics of Pseudomonas aeruginosa, followed by a brief discussion about biofilms, then a little bit about rhamnolipids, rhamnolipid synthesis, and the role of rhamnolipids in biofilm formation and dispersion. I'll follow that by discussing my attempts to replicate a simplified version of biofilm dispersal experiments. And finally, I'm going to be discussing the possible clinical applications of rhamnolipids in treatment and biosensors. To start off, Pseudomonas aeruginosa is an opportunistic pathogen, meaning that it exploits breaks in the host defense to initiate infection. Pseudomonas aeruginosa is the epitome of an opportunistic pathogen. It almost never infects uncompromised tissue, yet when the tissue is compromised, there's hardly a tissue type it can't infect. This includes skin, urinary tracts, bones, GI, and blood. Pseudomonas aeruginosa is a leading nosocomial multi-drug resistant pathogen, making it a topic of a lot of studies. So how does Pseudomonas aeruginosa do all of this? How is it multi-drug resistant? Why is it a leading nosocomial pathogen? And a simple answer to that would be biofilms. Biofilms are bacteria cemented together in a secreted polysaccharide extracellular matrix. And these matrices often include proteins and release DNA. Once bacteria have formed a biofilm, it's almost impossible to eliminate it. These bacteria become resistant to phagocytosis, antibiotics, and even mechanical displacement. Pseudomonas aeruginosa likes really moist environments, which are common in hospitals, for example, endotracheal tubing and indwelling catheters. So that makes this pathogen very, very dangerous in nosocomial environments. Pseudomonas aeruginosa biofilm development and dispersal is regulated by the Rh1 quorum sensing system. So this system is in charge of regulating the biosynthesis of these rhamnolipids. These rhamnolipids act as a biosurfactant and disturb the cell-to-cell and cell-to-substrate interactions, in turn regulating the maturation and dispersal of these biofilms. This is a figure from a 2014 study investigating the role of rhamnolipids on biofilm dispersal. In figure A, we can see rhamnolipids indicated by the small red stars at a low concentration. Therefore, the Pseudomonas aeruginosa cells are adhering to the surface. In figure B, we can see a high concentration of these rhamnolipids, and the Pseudomonas aeruginosa cells are not adhering to the surface at all. They are remaining modal. Then in figure C, we can see that these rhamnolipids are playing a role in the maintenance of the biofilm. And finally, in figure D, we can see that at the late stages of biofilm development, rhamnolipids are promoting the dispersal of these cells. So for my biofilm dispersal experiment, I chose a crystal violet assay. They're fast, reliable, and a good method to quantify biofilm biomass. So what I did is inoculated my bacteria of interest into a 96-well plate, like we can see in this figure. And then hopefully once I have optimized this biofilm assay to treat with rhamnolipids to assess the effects on these biofilms. One way you can get these rhamnolipids is either supernatant from a strain of Pseudomonas aeruginosa that produces a lot of these rhamnolipids, or you could just prepare a standard. So for biofilm assay optimization, I've had quite a hard time with it. There's a lot of questions to answer. So should I use a treated 96-well plate, an untreated? What is the dilution factor? How long should I incubate them? What is the concentration of crystal violet that I should use? What should I use for the elution step, acetic acid or ethanol? So these are a lot of the questions that I've been trying to answer with optimizing my biofilm assay to assess the effects of rhamnolipids. One problem I ran into was using nutrient-rich medium, which was recommended by a lot of studies. However, I saw that my bacteria remained at the air-liquid interface and didn't actually form biofilms at the bottom of the 96-well plate. My next step is to hopefully use mineral media and see what happens with the biofilm formation. So whether my experiment works out or not, what are the implications? What are the clinical implications of all of these studies investigating the effect of rhamnolipids on biofilm formation? So one of the most interesting clinical cases we can see of Pseudomonas aeruginosa biofilm formation is in cystic fibrosis patients. Cystic fibrosis is due to a genetic malfunction of the chloride channel, which leads to mucus clogging the airways in the lungs and trapping bacteria, leading to infections. About 80% of cystic fibrosis patients are chronically infected with Pseudomonas aeruginosa. Pseudomonas aeruginosa is able to persist in their respiratory tract in spite of their innate immune defense and the intensive antibiotic therapy that they go through. So we can see through a lot of studies that the switch back and forth from this biofilm mode using the RH1 quorum sensing system is important for its persistence in cystic fibrosis lungs. So what is hopefully a positive outcome from all these rhamnolipid studies? Well, in a biotechnology sense, scientists have started to use rhamnolipids or other quorum sensing molecules as biomarkers to detect Pseudomonas aeruginosa or other biofilm forming bacteria in the sputum of cystic fibrosis patients, which is really exciting and hopefully becomes more accessible and a more direct way to diagnose these patients with chronic infections. In a more direct sense, rhamnolipids have started to be used in combination with antibiotics to break up those biofilms in cystic fibrosis patients' lungs and make that antibiotic more effective. So hopefully moving forward, these alternate treatments and biosensor technology can be used to combat the emergence of multi-drug resistant pathogens like Pseudomonas aeruginosa. Thank you, judges, for your time and consideration.